Okay, this is Dr. Hagberg. Many of you may know me, some of you might not, but I am going to go over some of our entrance testing that we do with our patients. What we're going to focus today on is the alternating cover test. There are two components to that. There is a distance that we use for alternating cover test and near. For our office and our team, we are going to focus on the near aspect of the alternating cover test. So when we talk about alternating cover test, we're going to use a occluder, occluding one eye, and you're covering that eye, which is going to break fusion, so the two eyes are focusing on one target. When you break that fusion, that eye is going to go to its relaxed position. What we want to know is where that eye is sitting when it's in its relaxed position. So you won't be able to know that until you uncover the eye and you see the movement of where that eye was at. So there are three categories. There's ortho, and think of ortho as orthodontist, orthopedic, that's straight, right? So straight ahead. And there's exophoria, which is when the eye is covered and then uncovered. That eye, if it's sitting out and moves quickly in, that would be exophoria. And then the same thing for covering and uncovering. When you see the eye in and shifting straight ahead, that's considered esophoria. Okay, so now we are going to demonstrate how to do the near alternating cover test with Dr. Shipton. So I'm going to just do it as what we would do with a patient, and then we'll talk about it a little bit afterwards. So Dr. Shipton, I want you to go ahead and focus on this target right here. The goal is about a foot away here. So while you look at the point of the rocket ship here, keep your eyes fixated there. And then I'm looking at the movement of his eyes. Typically, I am going to go and explain a few things. When you're covering one eye and you're at the near test, you want to hold it there for a minimum of 3 seconds. Okay. All right, so 3 seconds each eye, the near point about a foot away. And as I'm covering Dr. Shipton's eye, 1, 1,000, 2, 1,000, 3, 1,000, I'm going to switch over. I'm going to watch where that eye is sitting. And I saw the eye move in. Okay, so it was out and moved in to look at the fixation point. When it looked at the fixation point, that means it is exophoria. And I go back, and both eyes should do the same. Now, we always want to do this with correction. Their distance correction, not a reading power, but whatever they wear all the time. And if they don't have correction, they're a new patient, then that's okay. But if they have correction, we want this test to be done always with their glasses. And if they're wearing contacts, then that's okay as well, as long as we know they're wearing contacts. Perfect.